In this video, you're going to learn how to put type 2 diabetes in remission. Here's what you can expect to learn. First, we'll discuss why diabetes can't be cured and the difference between a cure and putting something in remission. Then we'll talk about the statistics into the probability of remission from type 2 diabetes, as well as 5 factors whether or not a person's diabetes can even be put into remission, and as well as how do you do it, the exercise, nutrition, supplementation strategies. Before we jump in, who am I? My name is Igor. I'm the author of the Amazon best-selling book, Type 2 Diabetes Reversal Secrets. If you'd like to purchase it on Amazon, click the link in the description below. As well, I run an online personal training company called Fitness Solutions Plus, which specializes in helping type 2 diabetics reverse their diabetes. I've also been training other personal trainers in my methodology since 2013 by speaking at some of the world's largest personal training conferences, and I've delivered over 400 presentations to some of Canada's largest corporations, including IBM, Bosch, American Express, University of Toronto, Investors Group, and others. If you want to learn when I publish more videos about exercise, nutrition, and supplements for type 2 diabetes and other conditions, click like and subscribe to my channel. So why can't diabetes be cured, and what's the difference between a cure and remission? Here it is. When you cure a condition, it means it's the complete eradication of the illness and there is nothing you can do to bring that illness back. By contrast, remission just means a state of absence of disease activity. In other words, if you improve your diabetes, if you cause it to go into remission by improved exercise, nutrition, supplementation, but then you stop the exercise, the nutrition, and supplements, the diabetes will come back. That's remission. A cure means you can stop the exercise, nutrition, and supplements, and diabetes won't come back. So diabetes can't be cured, but it can be put into remission. In fact, here is the definition of the American Diabetes Association. Here they have 2 criteria. One is that the HbA1c, or glycated hemoglobin, is under 6.5%, and you have been off medications for at least 3 months. If you meet those 2 criteria, according to the American Diabetes Association, your type 2 diabetes is in remission. That is their position statement. So here are some statistics on remission. Here's a study titled Incidence and Characteristics of Remission of Type 2 Diabetes in England. And again, I want to emphasize this is a cohort study, which means no variables were manipulated. This is just observation. So this study looked at over 2.2 million people, and it divided them based on the characteristics of different people who caused their diabetes to go into remission. So these are the people who did not achieve remission, and these are the ones who did. So it's less than 2%, but again, I want to emphasize, most of these didn't even try to reverse their diabetes. About 2% deliberately tried to reverse their diabetes. No variables were manipulated here. I want to emphasize that. Of those who achieved remission, 23% were between ages 60 and 69, 29% were between 70 and 79, and 16% were over 80. So that's quite encouraging. Furthermore, of those who achieved remission, 51% lost weight and 49% actually did not lose weight or even gained weight. And that should be encouraging because it means that you don't need to lose weight in order to reverse diabetes. It might be helpful, but it's not a requirement. Also, we should mention that perhaps the people who did gain weight were normal weight diabetics. Again, no variables were manipulated in this research. This is just a cohort study. Now, whether or not a person's diabetes can be put into remission depends on a number of different factors. One is very logical. How advanced is somebody's diabetes? The cutoff for diabetes is a A1C of 6.5%. It's much easier to go from 6.6 to 6.4 than it is to go from 10.6 to 6.4. So that's one factor. Another factor is if they have comorbidities, in other words, other health conditions besides diabetes, like heart issues, high blood pressure, etc. The more comorbidities that someone has, the harder it is to put type 2 diabetes in remission. Now, here's another factor, which is ethnicity. White people, Caucasians, do reverse their diabetes easier than others. Another factor is how rigorous is someone with their lifestyle changes. Does somebody exercise twice per week, or are they exercising 6 days per week? how often are they eating out, how much good food are they eating, how much fiber are they getting, protein, and so on. Here's what doesn't matter or doesn't matter very much: the age. It doesn't matter if you're young or if you're older, but in this study, what they showed is of all the people who put their type 2 diabetes in remission, 75% were actually over the age of 60, and only 25% were under 60. So your age doesn't matter. It's reversible even if you're over 60, 70, or 80. It also doesn't matter how long you've had diabetes for. In the same cohort study, the people of all the people who reversed their diabetes, 18% actually had diabetes for 10 years or more. These, and 82% had it for 10 years or less. However, again, I want to emphasize, this is a cohort study. No variables were manipulated. I'm reasonably certain, and we have great experience with it between my team and I, that when somebody deliberately tries to reverse their diabetes, in over 70% of cases, it's very, very doable, even if you've had it for 10 years or longer. So how do you reverse your diabetes? In no particular order, exercise, of course, helps. The potential of exercise, if you do it the right way for diabetes, it can lower your HbA1c by 1.0 to 1.5% on average. People with higher A1Cs see greater improvements. However, there is a difference between exercise for diabetes versus exercise for weight loss versus exercise for arthritis, etc. There needs to be specificity in exercise prescription. You need to know variables like which exercises do you do, how many days per week, how many sets, how many repetitions, how much weight, as well as on the cardio side of things, what's the intensity, what's the duration, what's the pulse, etc. I go into all of these variables in extremely great detail in my video on diabetes exercise, which is on your screen right now, as well as in the description below. So that's the exercise side of things. There's also nutrition. Normalizing or improving your nutrition can lower your HbA1c by between 2.5% and 4%. This is very, very potent. But to know what is good nutrition for diabetics, you also need to know variables like what's the most important nutritional factor for diabetes. And no, it's not carbs, which are the third most important factor. I elaborate on this in great detail in my video about what role do carbs play in diabetes and what are the two most important factors, more important than carbohydrates, when it comes to diabetes control. And you also need to know that normal weight diabetics actually have slightly different nutritional requirements compared to overweight diabetics, and I recorded a separate video about that as well. Click that on your screen right now or in the description below. Lastly, there are supplements that can improve your diabetes. There are 4 supplements out there that can lower your HbA1c by more than 1%. And there are a bunch of supplements that claim to have effects, but actually don't. The supplements that are effective, I recorded a special video about them titled Underrated Supplements for Insulin Resistance, and you can check that out on your screen right now or in the description below.